to do something to try to enhance their smile. There's a difference between who's a good candidate and who can become a good candidate, okay? And we can kind of talk about that a little bit. But a good candidate is somebody that has you know, darker teeth than what they want. Not a lot of really deep dark stains or gray stains or deep dark brown stains of their teeth, but maybe just an overall hue of their teeth is darker, more yellow. Okay, so the yellowish kind of teeth tend to get lighter easier, but like what we talked about, who can become one, you know, the other thing is that somebody that has a lot of restorations in their mouth that all match up pretty good right now, that might be somebody that could still be a good candidate for lightening their teeth, and their teeth would brighten pretty well, but we would just need to be sure that they understand that there's a possibility that some of their dentistry might need to be replaced to match that new brighter smile, which is okay, and patients do that all the time. But I always want to advise patients, I don't want them to find out after the fact, well, now my teeth here look nice and white, why aren't these? Well, that's because that's a crown and it's not going to change, and that's a filling or whatever. So they can become good candidates is what I mean, is that, you know, we just plan for that to be, when we get to the brightness that you want, we've got a couple restorations here we're going to change out, and then you can have that nice bright smile. So, you know, patients that maybe have really, really extreme sensitivity, sometimes they might be a guarded candidate for lightening because there can be some temporary cold sensitivity or sensitivity to the teeth with lightening, but usually that's transient. Usually it goes away. And it doesn't mean that that patient can't necessarily be a candidate. Sometimes we'll do things with different medicines that we'll use in the trays for a few weeks prior to trying the lightening that can reduce their overall sensitivity altogether. And then they go a little slower with their lightening process, and they can still get the same result without the side effects of maybe having that sensitivity that's not tolerable. Somebody that just is really, really extreme, they just may not be, you know, a candidate for that because their teeth are just too sensitive. And there's a lot of reasons for sensitive teeth, and obviously we want to make sure that there wasn't any dental disease as a source of that. So we'd want to make sure that we get the mouth in the best oral shape. We don't want to have somebody lighten their teeth if they have cavities, so we definitely want to make sure we take care of any disease that's going on before they become a candidate to do lightening.